Antibiotics work to combat bacteria. They may work to kill bacteria, in which we call them bactericidal, or inhibit bacterial growth, in which we call them bacteriostatic. Penicillins are the oldest form of antibiotics and as such tend to be the least expensive. They kill both gram-positive and gram-negative bacteria by destroying cell walls. There is a high rate of allergies to penicillin, so patients must be screened before being prescribed these medications. Drugs in this category tend to end in -cillin, such as ampicillin, amoxicillin, and penicillin. Cephalosporins work similarly to penicillins. However, they have a lower rate of allergic reaction. They're divided into 4 generations based on their activity. First generation fight gram-positive bacteria. Second generation treat nosocomial pneumonia and pelvic or intra-abdominal infections. Third generation treat gram-negative bacteria. Fourth generation are used intravenously only for severe nosocomial surgical infections. Tetracyclines were commonly used in the 1950s through 1960s, but are not as commonly used now because there are so many bacteria that are now becoming resistant. They work by preventing protein synthesis and interrupting the reproduction of bacteria. These can also cause permanent staining on teeth of a child or fetus and should never be used in children or pregnant women. Macrolides inhibit reproduction of microorganisms by inhibiting protein synthesis and are used on a wide variety of conditions. Macrolide medication names generally end in -mycin, for example, erythromycin, azithromycin, and clarithromycin. Quinolones prevent bacteria from growing. They are generally reserved for use in antibiotic-resistant strains of bacteria. They are also commonly used for urinary tract infections. Medications in this category tend to end in -cin, such as ciprofloxacin. Sulfonamides, or sulfa drugs, kill bacteria by interrupting their metabolism. They collect in the bladder prior to excretion, and because of this, they are very effective with urinary tract infections. However, there is a high rate of allergic reaction to sulfonamides, so again, patients must be screened for an allergy before being prescribed a sulfa drug. Anti-tuberculosis agents are antibiotics that are specifically used to treat the Mycobacterium tuberculosis, or TB. They're a mixture of 2 to 4 medications that are taken daily for up to a year.